A left-sided kidney stone can cause pain in this area, but it can also cause pain in the lower abdomen or in the flank area towards the back on the side of the kidney stone and may radiate down to the groin. Usually, there is some associated blood in the urine or hematuria, even if it's only microscopic. Classically, pain from a kidney stone or renal colic is severe, and often patients are vomiting and thrashing about trying to find a comfortable position in a fruitless effort to relieve their suffering. Beware, what you think is renal colic in someone may in fact be a rupturing abdominal aortic aneurysm in the right person. Look for red flags like lack of hematuria or an older patient presenting with what looks like renal colic but has never had it before. Right lower quadrant pain can of course mean appendicitis in men or women. Similarly, you could have a diverticulitis in this area or the left lower quadrant in anyone. One must consider gynecological problems in all women with abdominal pain, especially in the lower quadrants. Neurological problems are a problem. Strokes can be devastating, and only in rare cases do we have a hope of doing something to reverse the damage, but we must treat with powerful drugs within 3 hours, with many strict conditions, so very few can hope to benefit. A threatened stroke, or TIA, is treated with aspirin and other similar drugs. More powerful blood thinners, such as Coumadin, are of use for only a restricted category of strokes or TIAs, such as those which occur in patients with a cardiac arrhythmia called atrial fibrillation. Lower back pain, called sciatica if it radiates down a leg, is treated with painkillers and time, unless there are significant associated neurological complaints like urinary incontinence. Then, and almost only then, would an emergency MRI and possibly surgery be indicated. Emergency physicians can manage most fractures and dislocations. Emergency surgery is usually only indicated when the fracture is open. That is, the skin over the fracture site is open, and with this, coming a much greater risk for infection. When women bleed early in pregnancy, it means that they may be miscarrying. Unfortunately, we can do nothing to alter the process. Our job is to determine if there is hope for the pregnancy, and if not, at least assure that their mother does not have an ectopic pregnancy or a pregnancy outside the uterus, which is a threat to the mother's life. This we diagnose via ultrasound and often blood hormone levels. These levels we may have to draw sometimes on 2 separate days, 48 hours apart, to see if they are rising or falling as they are supposed to. So, you now know enough to practice as an emergency physician, right? Stop being so arrogant. Of course you don't. For that, you need to spend at least 2 weeks with me. But, given the opportunity, I think that if you have the dedication and commitment and are responsible enough, anyone can do it. Even you.